Okay then.
Yes. All good to go.
Are we live?
We are live, ma'am.
Good afternoon, everyone. Today, we are doing this panel discussion from the Department of Endocrinology, Ramaiah Medical College and Memorial Hospital on the occasion of World Diabetes Day. As we all know that the number of adults with diabetes and as well as children with diabetes is progressively increasing, unfortunately. As of now, we have around 537 million adults, that is 1 in 10 adults have diabetes at the moment in the world. And the number is expected to increase by further numbers in the next coming years. Also, the unfortunate part is 1 in people with diabetes actually remain undiagnosed. So that is why we have assembled today to discuss how to best manage the diabetes, what are the things we need to follow to take care of your blood glucose values, and also what best care we can give to our patients. So we will be open for questions as well. So you are welcome to put your questions in the chat box and we're happy to answer those questions as well. So I invite Dr. Ganvi to please start.
Thank you, Dr. Pramila, Dr. Chitra, and Dr. Suryanarayan and Dr. Mala ma'am for giving us this opportunity to conduct this panel discussion. So without further delay, I would ask Dr. Chitra, Dr. Manjunath, and Dr. Suryanarayan and Dr. Mala to introduce themselves, and Dr. Himanshu to go ahead with the questions.
Should I start?
Yes.
A very good afternoon. This is Dr. Chitra Selvan, Associate Professor, Ramaiah Medical College, Department of Endocrinology. And we're really looking forward to taking questions from you. So please feel free to type in your questions in the chat box. We'll be very happy to take it. Thank you.
Shall I, ma'am?
Please.
Yes. Good afternoon, everyone. So I'm Dr. Manjunath PR, working as Assistant Professor in Department of Endocrinology, Ramaiah Medical College. So we are all here to discuss about diabetes this on this World Diabetic Day. So thank you. So we'll be happy to answer and share few points here.
Yeah, Dr. Mala.
Dr. Suryanarayan, go first, then I'll go last.
Yeah, very good afternoon to all. I am Dr. Suryanarayan. I am retired as Senior Professor of Endocrinology in the Department of Endocrinology at MS Ramaiah. I am continued to work as Consultant Endocrinologist in MS Ramaiah Memorial Hospital. We'll be all happy to take the questions from you. Thank you.
Good afternoon, everyone. I'm Dr. Mala Dharmalingam. I'm Senior Professor in Department of Endocrinology, Ramaiah Hospital. And today's occasion is World Diabetes Day, which is November 14th, which should have been yesterday, but we are celebrating it today. And the goal of this year, or the slogan, is to get the care of diabetes. How many of us can reach a good diabetologist, endocrinologist, or the care that is required for our management. So towards this discussion, we'll be talking to you, and do feel free to ask us any questions.
I now request Dr. Himanshu, Dr. Harshita, and Dr. Harikiran to go ahead with the questions.
Yes, ma'am. So I'm Dr. Himanshu, Senior Resident in Department of Endocrinology. So we'll start our discussion today. My first question is to Dr. Pramila Kalra. Ma'am, can you tell our audience about what is diabetes and why India is becoming diabetic capital of the world?
Yeah, thanks, Dr. Himanshu. This is a very important and a pertinent question. So just to introduce myself, I'm Dr. Pramila Kalra. I'm Professor and HOD Department of Endocrinology, Ramaiah Medical College and Hospitals. And as Dr. Himanshu asked the question, what is diabetes? Now, this is very important. Now, diabetes means diabetes mellitus is what we are discussing today. And diabetes mellitus means the blood glucose levels in the body are high. That can be due to insulin deficiency, insulin resistance, meaning the insulin is not working properly, or there may be some drugs which may cause the insulin not to work properly, and then also the glucose values may go high. So because of whatever reason the glucose values in the blood have gone high, then we call the patient to have diabetes mellitus. The number of patients of diabetes is definitely increasing in our country. And we should know basically that there are different types of diabetes, which we'll be discussing in the panel discussion. But just to start off, we have type 2 diabetes, which is the commonest diabetes, where the insulin is there in the body, but it is not able to work properly. Then we call it as insulin resistance. But later on, the insulin is deficient also, and these patients may require insulin for their treatment. And then we have type 1 diabetes, where the insulin is not at all present in the body and the treatment is only insulin. We have different other types of diabetes which comes in pregnancy and because of some drugs and hormone excess, but we'll be discussing that. Now, why diabetes is increasing in India? The reason is change of lifestyle. Previously, people used to work, they never had machines, they used to walk. Now, what's happening? Everybody has a car or a bike or some way of transport. They're not walking, exercise is not there, access to junk foods is there, and there is terrible lack of exercise. More so now because of COVID-19, people are locked inside their houses most of the times. But previously, also the lack of exercise was quite rampant. Along with that, we know that Indians have a higher propensity to get insulin resistance, means diabetes, even with less fat increase. So even if an Indian patient is little bit obese or overweight, their tendency to get diabetes is much higher as compared to a Western patient. So that is why we have to understand that with time, people have to start more of lifestyle modifications because it's a lack of lifestyle which is causing the increased incidence. We cannot change our genes, but we can change what we do. And there are other risk factors, like if a patient is a smoker, they take alcohol, all these factors also further add to the problem. So basically, it is more of lack of lifestyle, access to junk foods, lack of exercise, also lack of knowledge about it, because many people think that children don't have to exercise and they can eat all junk, but that's not true. Whatever the mother eats before the child is born, or when the child is in the mother's womb, that also has a bearing whether that child will develop obesity, diabetes, or overweight in future. So it is very important that the diet control, exercise, lifestyle should start from that time. That means from the childhood period itself.
And thank you, ma'am, for that detailed answer. And now I'll go to Dr. Mala, ma'am. Ma'am, this is a relevant topic now. Is there any increasing prevalence of diabetes due to COVID-19? And if so, why?
Thanks, Himanshu. Definitely, this is a very, very relevant question now because we've seen the first wave and second wave, and thank God we are not seeing so much of a third wave. We'll just cross our fingers and hope for the best. As far as diabetes prevalence is concerned, there are many reasons why diabetes has increased with the presence of COVID. First and foremost, we can divide it into two parts. One is those who already have diabetes and those who did not have diabetes earlier but have got it now. So those who have diabetes earlier, they possibly had worsening of sugar with the infection, because as we know, any infection will worsen the blood glucose. So the blood glucose may go high, and then control that might take a longer time. But looking at just new onset diabetes, so it may be that they were diagnosed, they were earlier diabetes, but we didn't know. They were diagnosed first during COVID itself, or they became diabetes due to COVID. Here it can be due to two reasons. One, we know that there is destruction of beta cell. Now, what is this beta cell? This is a cell which is present in the pancreas, which is the organ which secretes insulin for sugar control. And this beta cell is destroyed, what we technically or medically call apoptosis. So there's destruction of the beta cell, wherein the insulin production becomes less and then the sugars go high. It can be that the COVID infection itself causes inflammation, and there is lot of what we call cytokines. Cytokines are inflammatory response to the body's infection. This can also cause increase of blood glucose. The third is the treatment of COVID. Very often people are given steroids. So this steroid may cause the glucose to go high, and that is why people get glucose, higher sugars. Will this go away? May not be completely. It may stay or it may go away once the COVID infection is over, but they may get in the future. Supposing patient did not get, he got COVID infection, he did not become diabetic. Can he rest peacefully? No. Every 3 months, he should get a glucose tested for 1 year, because though now he does not have, he may get diabetes within this 1 year. So that is the recommendation of Government of India and WHO, which says that every 3 months, please check up your glucose, even if you're not a diabetic, if you've had COVID infection, to see if you get new onset of diabetes. So this is what I would like to tell everyone. But if you have COVID, don't worry, it will go high because of all these reasons, but a good care will definitely bring it down. Thank you.
Thank you, ma'am. Hopefully, we'll not have the third wave in India. So my next question is to Dr. Chitra. So, ma'am, can you explain about what are the risk factors for development of diabetes? And is there any way to prevent or delay the onset of diabetes?
Thank you, Dr. Himanshu, for that question. I think after listening to Pramila and Dr. Mala, we have some risk factors at least. Dr. Pramila did tell us that as we are at a simple would be, we have been a country in which we've had mind out for centuries, and we have increased this to suddenly. Now, these over centuries, important for survival, very food, suddenly exposed to large amounts of nutrition, it is unable to cope with nutrition excess, and we have increased risk of diabetes. So, entire country is at increased risk. Of course, we all know that if you have one family member with diabetes, our risk of diabetes is high. Who is a family member? Your mother, father, sisters, grandparents. So your first and second degree relatives. If there is one person in your family, your risk is up. If you have two people with diabetes, your risk goes up significantly. The third thing is, if your BMI is high, then your risk of diabetes increases. BMI andre eno, if your BMI, it's a ratio which is weight against your height. Very, very few people are in the normal BMI range today in the current world. So almost all of us are overweight, and that is a risk factor. Living lives where we sit down for the most part of our day is a very important risk factor. Age is also a very important risk factor. Now, if you ask me at what age does the risk goes high, it's a very difficult question to answer, because we are now, as pointed out by Dr. Pramila, diagnosing small children in school aged 12 and 13 years with type 2 diabetes. So there is no age which is protective for diabetes, but with increasing age, understand that our risk goes high. If you are on medications for hypertension, cholesterol, or if you're on treatment for PCOS, know that all of these are risk factors for type 2 diabetes. And if you have diabetes during your previous pregnancy, you're at increased risk for type 2 diabetes. But all risks cannot be changed. Like, for example, you can't change your family, you can't change your ethnicity. But there are certain risk factors that you can definitely change. One of them is number of hours sitting down or being sedentary. So staying active is very important. And as pointed out by Dr. Mala, certain drugs like steroids can also increase your risk of type 2 diabetes. So have a conversation with every new medication that you started and find out, does this increase my risk of diabetes? Similarly, certain drugs used to treat mental health issues also can increase your risk. So have a word with your doctor, does this increase? Can we prevent diabetes? If I have a family member with diabetes, does that mean I will 100% get type 2 diabetes? No. There have been many trials done to show that you can prevent diabetes, and not even by drastic things. All you need to do is get around 150 minutes of physical activity per week, which translates into roughly 30 to 40 minutes of exercise per day, choosing to eat healthy most times of the day. Does that mean you'll have to live like a hermit, not participate in all the fun which happens in our life because all enjoyment in families happen around food? Not really. Even if you choose to eat healthy most days, allowing yourself to indulge once in a while you're still taking care of your health is a very feasible thing. Another thing that we need to do is once we check our sugars and then we say, I checked it 5 years ago and it was normal, that's also something which we need to change. We need to test maybe every 1 to 2 years, depending on your number of risk factors for type 2 diabetes. Thank you so much for the question. Over to you, Dr. Harshita.
Thank you, ma'am, for such a detailed answer. My next question will be to Dr. Suryanarayan, sir. What are the different types of diabetes and how do you differentiate between various types, sir?
Thank you, Dr. Harshita, and a very good afternoon to all. Partly this question has already been answered. I'll slightly elaborate on this. There are different types of diabetes. We can say mainly there are three types. One we call the type 2 diabetes. The other one is a type 1 diabetes. The third is the gestational diabetes. There are many other types, but these are the three main. What is diabetes mellitus? The mellitus, the word came because there is passing of sugar in the urine, melaturia. In type 2 diabetes mellitus, basically there is insulin secretion from the cells, what we call the beta cells, but the insulin is not functioning properly. That is what we call the insulin resistance. In addition, there can be slight deficiency of the insulin also. This usually occurs in adults, but now we see even in youngsters also in the age group of 15, 20 years, 25 years, getting this diabetes. Why this happens? Because of the altered lifestyle, there is increased deposition of fat, particularly across our tummy, and this fat makes the insulin not to function properly. That is what we call the insulin resistance. So basically, it is a lifestyle disease associated with some genetic predisposition, as Dr. Chitra said. So this is the commonest type of diabetes, which in our society, almost 90% of the population, if you say, they have got type 2 diabetes. So these patients, mainly because the insulin is there, the treatment rests on lifestyle modifications and associated with drugs which can act to increase the insulin secretion or modify it. Now, the other main type of diabetes, which is less common in our country, although it is becoming more and more for children getting, is called type 1 diabetes. Usually occurs in children, but also can occur in the later age, called the type 1, where the cells which produce insulin, that is the beta cells, due to some immunological mechanism, decrease in number, they undergo destruction. So there is insulin deficiency. So these patients may get into serious stage and come to the presentation, like they become unconscious with a condition called diabetic ketoacidosis, and they need lifelong insulin treatment. That is the only treatment as on today. So that's what we should emphasize again. There is no other treatment because there is no insulin in the body. These patients need lifelong insulin treatment. The third is the gestational diabetes. There are hormonal changes which occur in pregnancy. A lot of hormones which act against insulin are produced. And because of that, some of the ladies who become after pregnancy during the third trimester, usually after 22nd week, they develop increased blood sugar because of the increased insulin resistance. And these patients also need, in addition to diet and lifestyle changes, they need insulin for the treatment. Many of them remit or become all right after delivery, but may continue to have higher chance of developing diabetes in the later life, or they may continue to have diabetes even after delivery. So these are the three main important types. The other types, which we can say it is due to the disease of the pancreas itself. How can the pancreas can be diseased? Because of alcohol, because of some infections, or because of some drugs also, or many other causes also. When the pancreas is diseased, so the insulin secretion decreases, as well as there can be some enzyme deficiencies which can alter the digestion of the foodstuffs. So they may have malabsorption, maldigestion and all. So these patients also need insulin, but maybe initially they may respond to tablets also. This is another type called pancreatic diabetes. The other lesser common types, like what was mentioned earlier, is called the drug-induced. Steroids are commonly used, particularly in the COVID management now, and that's how a lot of diabetics who didn't know that we detect them to have diabetes. So steroids and many other immunosuppressive drugs, like antipsychotic drugs, they can also cause diabetes. The rarer ones can occur in children. And there is another important thing called the MODY, that is the maturity onset of the diabetes at the young, where there is a strong family history which is transmitted from parents to children and occurs at an younger age. And they also need proper treatment with tablets or insulin as a. So these are the main types, but the commonest one which you should remember or which you should know is the type 2, type 1, and the gestational diabetes and the pancreatic diabetes. Thank you, Harshita.
Thank you, sir. Thank you for giving us an information about various types of diabetes and how to differentiate them. My next question will be to Dr. Ganavi. Ma'am, what are the symptoms of diabetes and how do you screen for diabetes?
Dr. Harshita, for this question. So, as we are aware, the classical symptoms of diabetes, that is, we call this triad, includes polyuria, polydipsia, and weight loss. So, what is polyuria? Polyuria means so why does this occur in diabetes? This occurs mainly due to a process called as osmotic diuresis. So, what exactly happens in osmotic diuresis? So, basically, when the blood glucose exceeds a particular level, the renal absorptive capacity decreases. So that's when the glucose starts getting filtered in the kidney, as well as it drags the water along with it. This causes frequent urination. This we call it as polyuria. Because of polyuria, there is also associated excessive thirst. This we call it as polydipsia. So the third symptom, that is the weight loss. So why does weight loss occur in diabetes? So as we know, because of osmotic diuresis, as I mentioned earlier, there is a loss of excess water from the body. So this causes some amount of weight loss. Also, as we know, insulin being an anabolic hormone, in diabetes, there is both insulin deficiency as well as insulin resistance. So this also causes weight loss. Also, there is another symptom, polyphagia as well. So apart from these classical symptoms, sometimes the patients present directly with complications of diabetes. So the complications of diabetes can be broadly divided as microvascular complications and microvascular complications as well. So coming to the microvascular complications, that is the involvement of the blood vessels, which are smaller blood vessels. So they mainly include diabetic retinopathy, diabetic nephropathy, and diabetic neuropathy. So the patients can actually first time present with blurring of vision, loss of vision, floaters, or flashes of light. So these are the symptoms of diabetic retinopathy. So sometimes the patients can directly present with diabetic nephropathy in the form of pedal, like lower limb swelling, that is the pedal edema, or uncontrolled blood pressure as well, or frothy urine, or even facial puffiness. So these are the symptoms of diabetic nephropathy. So also the patients can present with symptoms of diabetic neuropathy in the form of they develop glow and stalking sensation, what we call as pins and needle sensation over the hands and feet. Also, they can develop distal muscle weakness in the form of slippage of the foot. So these are the neuropathy. So diabetes can involve the larger vessels as well. That is the macrovascular complications. So patients can directly, as we know, recently we have had a number of patients who present actually with sudden onset of heart attack as well, and they're diagnosed to have diabetes then. So the macrovascular complications of diabetes include the coronary artery disease, where they can present with myocardial infarction or even failure. And it involves the cerebral vessels as well. So they can present with stroke also. Also, the peripheral vessels can be involved. So that is called as the peripheral arterial disease, where some of the diabetic patients directly present with ulcers or non-healing wounds, even with intermittent clotting. That is on walking or for a smaller distance, they feel pain in the calf muscles. So these ways with which diabetes present. Also, sometimes the diabetic patients can present with infections for the first time. So if they have recurrent skin infections in the form of carbon, or if they have infections, that is the infections of the kidney. Also, these are the ways in which the diabetic patients can first time present to the hospital for the first time. So the next part of the question, that is, how do we screen for the diabetes? So as we know, that is, we need to screen all patients for diabetes. So as we know, we all come under a high risk ethnicity, that is the South Asians. So we need to be screened for diabetes. So it is important for testing the asymptomatic people, that is adults of any age with diabetes, especially if they are overweight or obese. So overweight we define as a BMI criteria of more than or equal to 23 kg per meter square, or if they're obese, that is a BMI of more than or equal to 25 kg per meter square. And if they have these additional risk factors, that is, as I mentioned already, high risk race or ethnicity, if they have a first degree relative, that is a strong family history of diabetes, or if they have had a history of cardiovascular disease, or if they have taken medications for blood pressure or cholesterol. So all these patients should be screened for diabetes. Even those patients with PCOD, if they have a sedentary lifestyle, or if they have associated conditions of insulin resistance, that is, if they have acanthosis, if they are severely obese. So all these patients need to be tested for and screened for diabetes. So otherwise, if these risk factors are not present, so all people should be tested for diabetes at the age of 45 years. If these results are normal, then repeat testing should be done once in 3 years. So as Dr. Suryanarayan also mentioned that we need to screen patients with, especially pregnant women, for the presence of gestational diabetes as well. So it should be done in the first prenatal visit, and again it should be repeated at around 24 to 28 weeks if the results are normal. Also, it is important to screen the children and adolescents, as we know that there has been a overwhelming increase in the number of diabetic cases in children and adolescents. So it is important to screen the children and adolescents if they have obesity, or if they have features of insulin resistance, or if there is a maternal history of gestational diabetes, and if they have a strong family history of diabetes as well, and if they are obese and overweight. Thank you, Dr. Harshita, for this question.
Thank you, ma'am. Thank you for comprehensively summarizing the various symptoms of diabetes and when to screen for diabetes. My next question is to Dr. Manjunath. Sir, what are the glycemic targets for diabetes? My next question is to Dr. Manjunath. Sir, what are the glycemic targets for diabetes?
Yeah, got it, Harshita. Thank you, Harshita.
Yes,
So
yes,
glycemic targets are put forward by several guidelines. So the most commonest guidelines what we usually follow is American Diabetes Association, and it clearly says that for non-pregnant adult diabetic patients, there are few parameters what we have to measure. So with respect to preprandial plasma glucose values, the target blood glucose ranges should be between 80 to 130 milligram per deciliter. And if it is postprandial blood glucose levels, it has to be less than 180 milligram per deciliter. And the other parameter what we can select is HbA1c, which is a 3 months average. So with respect to HbA1c, the targets are different for different categories. Majority of the patients who are stable and whose life expectancy is more. So our target is to measure to target as less as possible, less than 7%, with very less chances of hypoglycemia. And in those patients whose life expectancy is less with more complications, the HbA1c level can be relaxed and it can be even to 8 or slightly more. So this is regarding the non-pregnant diabetic patients. When it comes to pregnant ladies, American College of Obstetricians and Gynecology has put forward few targets for these people. In these people, the fasting plasma glucose value should be less than 90 milligram per deciliter, and The 1 hour postprandial blood glucose level should be between 130 to 140, and the second hour postprandial blood glucose level should be 120 milligram per deciliter. So these are the routinely used glycemic targets in the present day practice. But as the science has advanced, we have something called as time in range, because the usage of continuous glucose monitoring system has slightly increased nowadays. So the parameter called HbA1c might be replaced with something called as time in range when we are using continuous glucose monitoring system. So when we are using this one, the most important parameter is time in range. The time in range is the blood glucose levels between 70 to 180 milligram per deciliter. So in type 1 and type 2 diabetic patients, the time in range should be maintained between 70 to 180 milligram, at least more than 70% of the time. And older and high risk patients, at least this target has to be maintained more than 50% of the values. And in pregnant type 1 and type 2 patients, the time in range is between 63 to 140 milligram per deciliter, and at least 70% of the value should be maintained more than at least more than 70% of the value should be in this time in range. So these are the few targets what have been put forward, and these are the things what we usually use in our routine practice. Thank you. Over to you, Ashita.
Good afternoon. I am Dr. Harikiran, Senior Resident from Ramaya Endocrine Department. Sir, thank you for clearing that up. My next question is for Manjunath sir only. Sir, what is the importance of regular visit to the treating physician?
Yeah, thank you, Harikiran.
Yes.
So we all know the importance of regular visits, because there are many things what we have to see when the patient comes back to us. So it is very important for the patients to have routine visits for few reasons. Like suppose patient we would have started on some medications, and especially in our in our diabetic patients, supposing if they are on insulin. So it is very important for us to reiterate how and see whether they are taking the right dose of insulin with the right insulin syringe, whether the insulin storage is better, whether the technique is better or not. So most importantly, it is for making sure that the patient is taking the medications properly. One thing. The second thing is whether the patient is adherent to the medications, and whether the patient's blood glucose levels are falling into the target or not. This is another important thing what we have to see, and this is the reason why they have to be under follow-up. Not only this, whenever the patient comes to us, we don't usually only see the optimum blood glucose level, it is under control or not, but we also tend to see the potential risk that may go unnoticed if the patient won't come to the OPD visits, because majority of the time patient might have a small ulcer, or patient might have a severe neuropathy, or patient might have some form of retinopathy. All these things, until unless patient comes to hospital, we usually won't get to know, because these things might get unnoticed, might go unnoticed. And the most important thing is, apart from these things, you have to screen for different types of complications of diabetes, like retinopathy, neuropathy, nephropathy, or coronary artery disease, or peripheral arterial disease. All these things, because earlier detection leads to prevention of majority of the complications. It might ultimately help in reducing the dreadful complications like amputations or death even. Not only these things, follow-up is very important, because there is something called as immunization. Seasonal variations, seasonal vaccines are available, which has to be administered in different seasons, or like according to the different pandemic situations like this, like COVID. And it's also important for the patients to have regular visits to get updated about the latest drugs, which might be beneficial, which might be apt for them to be inculcated at that point of time. So these are all the reasons why the patient has to be under constant follow-up, not only for proper maintaining the blood glucose levels, but also to prevent the further complications. Thank you.
Thank you very much, sir. My next question is to Dr. Ganavi. Madam, there are lots of myths and fears among diabetic patients about COVID-19 vaccination. What is the advice for diabetic patients about COVID-19 vaccination, and what is the role of immunization in diabetes?
Thank you, Dr. Harikiran, for this question. So initially, when there was a surge of COVID-19, the questions asked were, I'm a diabetic, what should I do? Do I need admission? Over time, however, the question has changed. So now the question is, should diabetic patients take vaccine? an easy question. Yes, I tell everyone that I got the vaccine, my parents got the vaccine, so everyone, each one of us should get the vaccine. So we know the devastation COVID-19 can have in diabetes, in diabetic patients, especially in diabetic patients. So anything and everything we can do to prevent infection, or at least the serious infection, is worth it. So the next question is, people say it's not 100% effective. Though it's not 100% effective, at least it is 70 to 80% effective, which is better than 0%. So even people who are worried about the side effects of vaccine, like low-grade fever or which usually last for about 48 but this is better than landing up in ICU in a ventilator. So there are a lot of good reasons of taking COVID-19 vaccine. So some people also ask, some diabetic patients also ask, I already got COVID-19 vaccine. So it's already got COVID-19. So should I take the vaccine again? Though I'm not an expert in this area, the guidelines state that even if the patient is infected with COVID-19, the patient should get vaccinated after a period of time. And the next question is, which is the best vaccine for diabetes? So any COVID-19 vaccine available is good enough. So people are worried that this is 75% effective, that is 88% effective. So any vaccine we get will be protective, as these have gone through clinical trials and we've had real world experience of more than 8 months with these vaccines. So it is important that we take whatever is available as of now. So also many of the diabetic patients also ask, do diabetic patients get sicker after vaccine? So not that I'm aware of, or not do the published literature say that diabetic patients get sicker following vaccination. So, but theoretically, there could be short-term effects on the blood glucose in the form that because these vaccines can stimulate the immune system and many hormones or chemicals are released in response. That is, this is called as stress response. So these can affect the blood, so both exogenous and endogenous insulin. And you might find these blood sugar less than to keep track of blood. The patient is on oral antidiabetic drugs, which can cause hypoglycemia. But the effect on the blood glucose is very short. I have never come across these variations at all. Also, the next question is those who are on insulin pump or sensors, will it affect the delivery of the insulin pump or the detecting or the sensor ability? So the vaccination will not affect the pump delivery nor sensor ability as well. So coming to the next part of the question, that is the role of immunization in diabetes. So as per the ADA, that is the American Diabetes Association, it is recommended that routine recommended vaccine for children and adults with diabetes should be encouraged as per the age. So also all annual vaccinations against influenza is recommended for all people, especially if they're more than 6 months of age, especially for those with diabetes. Also, vaccination against pneumococcal disease, that is the 13-valent conjugate vaccine, is recommended if the child is less than 2 years, or if the patient is between 2 to 64 years with diabetes, they should receive the 23-valent pneumococcal vaccine. So if the patient is more than or equal or 65 years of age, irrespective of the vaccination status, they should receive the 23 pneumococcal vaccination. So for hepatitis B, because proper equipment used like the GRBS devices or the insulin needles as well. So at least 2 to 3 doses of hepatitis B vaccination, depending upon the vaccine, should be administered to unvaccinated adults with diabetes if they're in the age group of 18 to 59 years. If they're more than or equal to 60 years of age with diabetes and they're unvaccinated, at least 3 doses of hepatitis B vaccination is a must. Apart from these, other vaccinations like the Tdap, the zoster vaccine should also be administered. Thank you, Dr. Hari.
Thank you, madam, for that for elaborately clearing that up. My next question is to Suryanarayan sir. Sir, what is the role of comprehensive medical evaluation in the management of diabetes?
Thank you, Dr. Harikiran. Comprehensive diabetic management. Now, why diabetes is a chronic disease? What happens if the blood sugar is high and if it is not looked after, it can lead to a lot of complications. It can damage the kidneys. It can affect the heart, cause heart attacks. It can affect the nerves. Nerves start producing pain, tingling, numbness. It can affect the eyes, cause blindness. So it can affect each and every organ in the body. So if that is so, diabetes is such a dangerous disease. But surprisingly, when initially one gets diabetes, there may not be any symptoms, there may not be any complaints, patient may not be aware. So our aim, any patient who is diagnosed with diabetes, we should be able to prevent all the complications. How do we prevent? One is how we best we control his blood sugar, and also look for any existing complications if the patient has already has, and also take measures to prevent the further complications. So what do we do? He has to get his blood pressure checked, his weight checked, BMI calculated, so that if he is obese or overweight, he should reduce the weight. That's very important. The next is the blood pressure. Blood pressure is equally important like blood sugar, because high blood pressure in a diabetic along with high blood sugar can cause problem of the heart and damage the kidneys and other organs. So blood pressure check. The third is the cholesterol. We say good cholesterol, bad cholesterol. Bad cholesterol is LDL cholesterol. It may be normal. So all the diabetic patients should get their cholesterol checked. And anybody more than 40 years who is a diabetic, if prescribed a medicine for cholesterol, should continue to take the cholesterol medicine, because it is not just for cholesterol, it is to protect the heart and the other organs. So cholesterol check is important. The third, periodically we should check for any complications at all, whether it is the eye, the kidneys. How do we do? Every diabetic patient should undergo eye examination once in a year. And if there are any changes required, changes detected, what we call the retinopathy, should undergo more frequently, once in 3 months or once in 6 months, as advised by the eye specialist. So when he has gone to an eye doctor, in addition to this, what we call the retinal examination, the pressure changes, intraocular pressures, vision, all this needs to be checked periodically. The third is the kidney check. This has to be done every year in a type 2 diabetic patient. So how do we check the kidneys? They test the urine for what we call the protein loss in the urine, albuminuria, and sometimes used to call microalbuminuria. This has to be done every yearly. And if it has to be present, it should be repeated again after 3 months to reconfirm. And also see the kidney function by measuring the blood serum creatinine, which will give us, if we calculate, how much the kidney is functioning, 50%, 30%, 20%, like. These are the tests which every diabetic should undergo every year. In addition, the nerve examination in the hospital whenever they come, and they also should undergo other tests like heart tests if they have got symptoms of chest pain, or there is a family history of heart problems, or if they have high cholesterol. So all these things needs to be looked into, and also undergo a heart check with ECG, echo, or even with the CT angio if required. So these are the various tests periodically every diabetic has to undergo, with a view to detect any complications are there, and also if they are detected, to treat accordingly, or if they are not there, so that we know that the patient has got only hyperglycemia without any complications, so we can take the adequate precautions by instituting the lifetime measures and also giving the appropriate drugs. So in addition, what Dr. Manjunath has already said, the blood glucose level check, HbA1c, which shows the average of last 3 months, this also has to be done. So diabetes comprehensive management includes to detect any complications which the patient has, or to detect some of the parameters by which we can treat and postpone or make the patient not to develop this complication. Thank you, Harikiran.
Thank you, sir, for answering that question. My next question is for Dr. Chitra. Madam, what are the newer medications available for the management of diabetes?
Thank you so much, Dr. Harikaran. I know we are short of time. In the last 1.5 decades, we've had lots of new drugs which have been added. I'll briefly tell you about all of them. A new class of medications called DPP-4 inhibitors are in the market. They were very expensive to start out with, but now there are many new companies who brought it at a lower price. The biggest advantage of this class of medications is that it is only able to release insulin when sugars are high, but it does not have the potential to push you into low sugars. So this is a very, very big improvement, and it does make living with diabetes easy. So if you've known your doctor for the longest time, you should maybe meet and talk about this. Another class of medication which has come out in the last decade is a class of molecule called Sglt2 inhibitors. This molecule pushes out glucose in your urine, so your blood glucose levels come down. But because you're losing glucose in your urine, you're also losing weight, and it also has the ability to bring down blood pressure. But what is amazing about this molecule is that apart from bringing down your sugars and weight, it also has been shown to reduce your risks of heart attacks and cardiovascular events. We all know that the risk of heart attacks are higher in people with diabetes. This class of drugs can bring that down. It has also been shown to reduce kidney disorders or your creatinine levels going high. Another class of molecules called GLP-1 analogs are also new in the last decade or so. They are usually available as injections, which you take every day or once a week. It works again by increasing insulin level and also decreasing your appetite, and which in turn, what it does is it reduces your weight. This class of molecule also has been shown to bring down your risk of heart attacks. Now, in the last year, GLP-1 analogs are also available as tablets and is soon to be released into the Indian market as well. The name of the molecule is called oral semaglutide. But I know in everybody's mind, you're thinking about when will we get oral insulin. Trials are going on. We might see something happening in the next few years. Insulin is a peptide which is broken down the minute you take it, so you might have to wait. But large advances are being made in terms of injections which are painless, and also other forms of delivery of insulin, and also longer-acting insulins which you can potentially take every 2 days or maybe once a week. Thanks, Dr. Harshita. Over to you.
Thank you, ma'am. Thank you for summing up the newer medications, the risks and benefits in a nutshell. My next question is to Mala, ma'am. Ma'am, in this digital era, how technology can be used for the management of diabetes?
Thank you, Harshita. I think no talk can be complete without technology. And yes, there are two aspects again. One is what have we given for the patient? As far as monitoring, one of them have already said that there is continuous glucose monitoring. So in which you can actually understand how the sugar glucose behaves through the day for either 7 days or 14 days. I think that is a huge breakthrough. Sometimes the blood glucose is tested, it does not match to the HbA1c, and then we don't know where the sugars are rising. So if you have a CGMS, you actually know what is happening to your blood glucose through the day. It gives a power to the doctor as well as to the patient to understand what is the food he's taking, how does he react to that food, what happens to the glucose. So, and apart from monitoring, we also have, and some of these monitoring devices can be real time. They can actually tell you at that minute what is happening to the glucose. Apart from the technology, as far as insulin delivery systems have changed, the easier pens are there. So life has become much more easier for the diabetic, I won't say patient, person with diabetes. The other aspect is the consultation. So earlier, the consultation, whether it was teleconsultation or video consultation, was not allowed. Recently, the Indian Council of Medical Research, that is ICMR, has come out with guidelines for teleconsultation and video consultation, which I'm also part of. So I'm happy to share that these guidelines have to be followed if you have to do a video consultation, because there's a lot of issues involved. There's confidentiality. There are so many other aspects. You may not be able to deal with all of them over the video. But what are the steps you should take as far as getting the history, the physical examination as much as possible has all been documented. And I would request all of you to please go read it, all the patients. It's on the public domain, so you can understand. And definitely video consultation and a teleconsultation has made life for the patient much easier. Certain scenarios, especially gestational diabetes, pregnant women who are diabetic, they may find it difficult to come, and elderly who are finding difficult to come in this COVID era for exposures, all of them can make use of video and teleconsultation for an easier approach to their doctors. So I think these are the two main places or areas where technology has played a major role. Over to Harshita or Himanshu.
Yes, ma'am. Thank you, ma'am. So today's final question is to Dr. Pramila Kalra. Ma'am, this is perhaps the million-dollar question. There's a lot of talk going on about reversal of or remission of diabetes. So is there any diabetes cure? Or if it is there, how is it possible?
Yeah, this is a very important question, because a lot of times when patients come to us, the first time when they're diagnosed with diabetes, or even over a period of time, they ask us, the first thing is when my diabetes will be cured and when I will stop my medications. The first and foremost thing, we have to understand that diabetes is a progressive disease. So over a period of time, there is progressive loss of beta cells. If you do your lifestyle modification and exercise regularly, follow your doctor's advice for medications, you can help to stop or little bit halt the progression to further hyperglycemia, and you can be maintained on the medications. But when we talk about remission, now what is remission? Remission means when the patient is having a normal HbA1c. Now we have two criteria for normal. One is they are in the pre-diabetic range, that is called as 5.7 to 6.4 without medications. Some studies say minimum 6 months, but up to 1 year if they are without medications and they are able to achieve HbA1c value of 5.7 to 6.4 without any medication for at least 6 months, but good for 1 year, we call them partial remission. But when they have a HbA1c below 5.7 without any medication for 1 year, we call it complete remission. But the thing is that whenever there is a remission, this happens mostly in patients who have a new onset or a shorter duration of diabetes, who are younger, who have a borderline value, and they lose weight, they follow lifestyle modification, and their HbA1cs come to normal. But one thing I would like to stress on here, the patient should not forget that the diabetes is not gone. It is only controlled with your lifestyle. It's not that it has remitted forever and you can do no lifestyle, you can eat whatever you want and not do exercise and you will not get it. Don't carry home that message. The message is diabetes is there, but you have controlled it by doing good lifestyle modification, exercise, losing weight. You have to maintain it by continuing the same. If you stop doing that, after a few months or 1 year or few years, it will come back again. So follow lifestyle modification, do good exercise. There are other things also by which we can achieve remission, like bariatric surgery. Now, if patient is obese or morbid obese, there are guidelines where we can recommend some patients for bariatric surgery. But in bariatric surgery also, we have to have a proper consultation with the endocrinologist, bariatric surgeon, and then only take a call. In those patients, diabetes may go into remission, or mostly goes into remission after surgery. But again, they have to follow with their doctor after the surgery as well, because there may be many other problems for which they need to be seen. But there are other methods also, like low calorie diet, low carb diets. Now, low carb diets can be like around 120 grams of carb per day, or very low carb, like 20 to 30 grams. Those are called as keto diets. Now, keto diet should not be done on your own. You should do it in consultation with your doctor. If your doctor thinks that you are the right candidate, or intermittent fasting, these are varied things which people are practicing. But please don't do it alone on your own. Please follow with your doctor. If your doctor thinks it is good for you, do it. So what message I'm trying to convey is diabetes can be controlled. If you are off medications for 6 months to 1 year and you are maintaining a HbA1c below 5.7 without any medication, we call you as total remission. But then also you have to continue the lifestyle modification, a regular follow-up with your doctor for your blood glucose values. If it is between 5.7 to 6.4, you are in partial remission. Then also you have to follow with your doctor and follow whatever the doctor advises you with the lifestyle to be continued, and then you can lead a healthy life.
Thank you, ma'am. Ma'am, for the final part, I hand it over to Dr. Ganavi.
Everyone, it was a wonderful session with all the experts like Dr. Mala, Dr. Suryanarayan, Dr. Pramila, Dr. Chitra, and to have this session. So now to end this session, I would like to ask all of the consultants to just give a slogan regarding diabetes as a closing remark. So I would like to ask Pramila to start off with.
Yeah, so that is very important, and we should carry home all these slogans and follow that. So together we all can stop diabetes, and let's do it.
Here you Ganavi, Dr.
Already
Chitra.
had a lot of slogans there. Eh?
Dr. Please,
yes.
the slogan.
Yes. Protect family. A family eats together, plays together, so we should make healthier choices. What we choose to do in our recreational time, what we all choose to eat. Also make sure that we screen everybody. All the children are learning, looking at the adults, what we are doing. So we can't tell children to exercise when we are not exercising. So protect your family from diabetes as a family. Thank you.
Dr. Mala?
I think the most important message is, I would say, the slogan of this year, access to diabetes care. I think it's very important. Care is there, and we need to just make that effort to go to the hospital or to the clinic, to talk to our doctor, to keep them informed about everything that is happening in your life, so that we are with you. We are not on the opposite side. We are on the same side with the same goals, that we want to prevent complications which can happen in diabetes, lead a healthy life.
Dr. Suryanarayan?
Yeah. Everybody can get diabetes. So get tested when you have grown more than 40 at least, or even earlier if you are overweight. And if tested, don't become unhappy. Ask the doctor what medicines to take or what has to be done. Follow it regularly. You can have a normal health, normal life, active life. Don't be scared of diabetes. Try to beat the diabetes. Walk daily. Stop smoking. Avoid drinking. And take your family together. Have a healthy diet and go for a family walk and live happily.
Dr. Ganvi?
My slogan would be, don't let diabetes beat you. You have to beat diabetes by lifestyle.
Thank you. Dr. Manjunath?
Yeah, I think with the prevention now, so it is before this. I think once we know that we have the risk factor and we know that we are predisposed for it, we should start exercising and dieting to prevent diabetes rather than allowing it and then facing all the consequences. So stop diabetes before it starts.
So thanks, everyone. I think we had a very nice discussion. And what we are trying to communicate is prevention is always better. If we can prevent diabetes from happening, that's the best we can do with lifestyle modification. Do it. Start it today. If we cannot prevent, or if we have tried our best and still it happens, we are there to help you. Come to us. We'll help you with whatever lifestyle or diet or modifications of the medication is required. We are there to help you. So thank you.
Any questions from the public anywhere? No.
No, as of now there are no questions in the chat box.
Thanks, everybody.
Thank you, everybody.
Thank you.
Thank you. Thank you. Thank you, everybody.
Thank you.